New research has uncovered a deeply troubling connection between oral health and Alzheimer's disease, suggesting that bacteria commonly found in the mouth may play a direct role in the development of the devastating neurodegenerative condition. This revelation is particularly alarming because it shifts the focus away from traditional risk factors such as genetics and aging and points to a much more insidious and overlooked threat, one that millions of people may unknowingly harbor. If the bacteria responsible for gum disease can contribute to Alzheimer's, it means that a condition once thought to be confined to the mouth could have far-reaching and irreversible consequences for brain health. Scientists have identified the presence of Porphyromonas gingivalis, a bacterium linked to gum disease, in the brains of Alzheimer's patients. This discovery suggests that oral infections may not simply be a separate health concern, but could actually drive the very processes that lead to cognitive decline. The bacteria produce harmful enzymes called gingipanes, which have been found in the brains of Alzheimer's patients at levels that correlate with disease severity. These toxic proteins appear to damage brain cells, triggering inflammation and contributing to the buildup of beta-amyloid plaques, one of the defining characteristics of Alzheimer's disease. The idea that an infection originating in the mouth could be fueling the destruction of brain tissue is a disturbing prospect, as it challenges conventional understanding of how neurodegenerative diseases develop. What makes this finding even more concerning is the prevalence of gum disease. Millions of people worldwide suffer from periodontal infections, often without realizing the full extent of the damage being done. Symptoms like bleeding gums, bad breath, and tooth sensitivity are frequently dismissed as minor annoyances rather than serious health risks. However, if the connection between gum disease and Alzheimer's continues to be confirmed, it would mean that many individuals are unknowingly exposing themselves to a long-term threat that extends far beyond their oral health. Unlike genetic predisposition, which is largely beyond individual control, gum disease is preventable and treatable. Yet remains one of the most common chronic conditions, often ignored until significant damage has already occurred. Even more troubling is the possibility that bacteria from a mouth could enter the brain through the bloodstream or the nerves connecting the oral cavity to the central nervous system. This means that each instance of gum disease could be silently increasing the risk of neurodegeneration without any obvious warning signs until it is too late. The slow, progressive nature of Alzheimer's makes early detection difficult. And if oral bacteria are a contributing factor, they may be triggering damage long before memory loss and cognitive impairment become noticeable. The fact that something as routine as poor oral hygiene could be accelerating the onset of such a devastating disease raises serious concerns about public awareness and preventive care. Despite these alarming implications, oral health remains an often neglected aspect of overall well-being. Many people do not prioritize regular dental checkups or daily flossing, underestimating the importance of maintaining healthy gums. The potential link between gum disease and Alzheimer's suggests that failing to take care of one's teeth and gums could have far greater consequences than simply losing teeth. It could be contributing to irreversible brain damage. This raises urgent questions about whether enough is being done to educate people about the risks of poor oral hygiene, especially in aging populations who are already at higher risk for Alzheimer's. If gum disease is a modifiable risk factor, then improving oral health could become a crucial strategy in preventing cognitive decline. However, the challenge lies in how deeply ingrained poor dental habits are in many societies. Regular flossing, dental visits, and proper brushing techniques are often overlooked, and in many cases, dental care is expensive and inaccessible, particularly for elderly populations who may already struggle with other health concerns. If the connection between oral bacteria and Alzheimer's continues to be supported by further research, it would highlight a significant public health issue that has been ignored for far too long. It would mean that an easily preventable condition has been silently contributing to one of the most feared diseases of aging, and the consequences of that realization are profound. The possibility that Alzheimer's could, in part, be driven by an infection originating in the mouth is a sobering one. It suggests that decades of focus on genetics and brain-specific pathology may have overlooked a key contributor to the disease. If oral bacteria are indeed playing a role in Alzheimer's. It means that addressing gum disease could become a vital part of dementia prevention strategies. But for this to happen, awareness must increase and attitudes toward oral health must change. People must begin to view dental hygiene not just as a matter of keeping their teeth clean, but as an essential practice for protecting their brain. The implications of this research are unsettling. The idea that a common, preventable bacterial infection could be a significant factor in one of the most devastating neurological diseases is a wake-up call for both individuals and healthcare professionals. It raises urgent questions about how many cases of Alzheimer's could have been delayed or prevented if oral health had been taken more seriously. It also underscores the need for more aggressive public health initiatives to ensure that people understand the long-term consequences of neglecting their gums. If the evidence continues to build, then failing to address gum disease could be seen as an unacceptable oversight in the fight against Alzheimer's. In conclusion, the discovery of a link between oral bacteria and Alzheimer's disease presents a chilling new perspective on how neurodegeneration may develop. It suggests that an infection many consider to be a minor dental issue could, in reality, be a hidden driver of cognitive decline. This raises major concerns about the long-term impact of gum disease and the need for greater emphasis on oral hygiene as a fundamental part of brain health. If the cause of Alzheimer's is, at least in part, coming from inside the mouth, then preventing the disease may be more within our control than previously thought. However, this also means that millions of people may already be at risk without realizing it. The potential consequences of this research are vast, and ignoring them could be a costly mistake.